Hi, Rafael.
Hello, everybody.
Hello, welcome. Thank you for joining us from Spain. Thank you also for sharing your work with us. That's really important work for validating these one of these patient-reported outcome measures. That's fantastic. I wonder if I could start the questions. Why did you choose to test this in patients with carpal tunnel syndrome as well as Dupuytren's when the patient-reported outcome measure was developed specifically for Dupuytren's?
We were looking for a test to make a quick evaluation at the clinic, and we saw that the URAM provides us similar questions that patients we can evaluate in the clinics. One of the advantages that we have seen with the URAM is that with a quick vision, you can interpret the evaluation of the test. And that's the main reason we decide to evaluate the carpal tunnel patients for this test too.
Okay. So we have a question from Professor Sagan-Schmidt in the audience as well. He's wondering what major differences you found between carpal tunnel syndrome and Dupuytren's when you looked at their patient-reported outcomes.
Sorry, can you repeat, please?
Did you find any big differences between patients with Dupuytren's disease and those with carpal tunnel syndrome in your study?
No, initially there was a good correlation between their clinical results and with the carpal tunnel and improvement on the contracture of the Dupuytren disease. So we saw that the results were more similar with both pathologies.
Okay. We have another question also from Professor Sagan-Schmidt. Did you see a difference in your Dupuytren's disease patients between those with radial-sided disease over near the thumb and the index finger and those with the more common ulnar-sided disease over near the little finger and the ring finger?
There were only 50 patients in the series, and I think that there were no included patients with a thumb affectation, because when we try to make the studies, initially thumbs were not collected, and we don't include the patients with thumb affectation in our studies. So I can answer this question because there were no patients included with an index or thumb affectation.
Right. Okay. Jeremy, do you have any questions from your PROMS perspective?
Yeah, thank you very much. Yeah, very interesting piece of work, and I enjoyed it. One thing that I think is interesting with URAM is, from my understanding, when it was developed working with people before they had treatment for their Dupuytren's disease, and did not necessarily include people after treatment. We've talked obviously that you had people with Dupuytren's disease and carpal tunnel syndrome. Were they all before treatment, pre-op, or did you also have post-op patients involved?
We included patients. We made a first evaluation pre-op and made the retest calling by phone pre-op too, and we evaluated the patients after collagenase treatment 1 month after treatment, and for the carpal tunnel syndrome 3 months after treatment.
Because what would be interesting is to understand, not just whether they felt that the questions were relevant, but also whether they felt the questions were comprehensive. Particularly, if the question has been asked about carpal tunnel syndrome having some different symptoms, but perhaps also post-op patients experiencing different issues with their hand, as perhaps some people who've had treatment in the audience might have noticed, the URAM doesn't have any kind of pain type questions, and perhaps that was particularly problematic afterwards. So yeah, I think that would be very interesting to hear about. I don't know if you have any any data from that, from your study, and whether you could comment about that.
Initially, as I have told previously, we will look for a quick tool at the clinics. I think that for academic, in academic terms, we can compare with the Boston and the Dash. They provide more information about the pollution and the satisfaction and the clinics of the patient, but I think has its utility at the clinics.
Rafael, we have a question from Wolfgang Guach. He wants to know which treatments did you give to the patients with Dupuytren's when you were testing them with the Spanish URAM?
To get a good result and to make the work with validity, we have to include all the patients with the same treatment. We include all the patients who were treated with collagenase and were evaluated one month after the treatment, when in a place where we can see that the best difference between before and after treatment. Without that, if we make a new evaluation, the changes that we can see would be not so important, and we try to make this initial difference to check the results. All the patients were treated with collagenase.
Okay. It'd be interesting, as Jeremy was saying, to hear how the patients are before and after, and how they feel about it, particularly after surgery, which is obviously a bit more invasive than collagenase.
Yeah, with the treatment with fascectomy, we have to interpret it very cautiously, because the study specifies that these results are for this population and these terms of treatment. It's more difficult if we try to mix the treatments and times.
Thank you very much, Rafael. That was excellent. It's really important, I think, when we're thinking broadly and we're thinking internationally for getting these patient-reported outcome measures translated properly and doing that validity work in different languages, because I think certainly in the English-speaking world we're guilty of producing everything in English and not thinking about our colleagues and our patients in different countries. So thank you ever so much for presenting that. I now have the horrible task of sending you back to be an attendee, but thank you for joining us on the panel.
Thank you very much.